Unicare Moisturizing Lotion is used as a moisturizer to treat or prevent dry, rough, scaly, itchy skin and minor skin irritations such as diaper rash and skin burns from radiation therapy. It contains substances that soften and moisturize the skin, decrease itching and flaking, and protect the skin against irritation. The lotion works by forming an oily layer on the top of the skin that traps water in the skin, and it also draws water into the outer layer of the skin. Additionally, it contains ingredients that soften the top layer of skin cells, helping the dead skin cells fall off and leaving the skin feeling smoother and softer. Make sure to use Unicare Moisturizing Lotion as directed on the product package. Some products may need to be shaken well before use, so be sure to check the label for any specific instructions. You can apply the lotion to the affected areas of your skin as needed, or as directed by your doctor. The frequency of application will depend on your skin condition and the product you are using. For dry hands, you may need to apply the lotion every time you wash your hands throughout the day. If you are using Unicare Moisturizing Lotion to treat diaper rash, be sure to clean the diaper area thoroughly before applying the lotion. For radiation skin burns, check with radiation personnel to see if you can apply the lotion before radiation therapy. Remember to follow all the directions on the label for proper use, and only apply the lotion to the skin. Avoid sensitive areas such as your eyes, inside your mouth/nose, and the vaginal/groin area, unless directed otherwise by the label or your doctor. If you have any questions about where to apply the lotion, consult your doctor or pharmacist for more details. For best results, use this lotion regularly and apply it to damp skin after bathing or showering. If you have very dry skin, your doctor may advise you to soak the area before using the lotion. Keep in mind that long, hot, or frequent bathing can worsen dry skin. If your skin condition persists or worsens, or if you have any concerns about your health, seek medical help promptly. When using Unicare Moisturizing Lotion, most people experience no side effects. However, some may experience burning, stinging, redness, or irritation. If these effects persist or worsen, it is important to consult your doctor or pharmacist. If your doctor has prescribed this medication, it means that the benefits outweigh the risk of side effects. Many people using this medication do not experience any serious side effects. It is important to notify your doctor immediately if you notice any unusual changes in the skin, such as turning white, soft, or soggy from too much wetness, or signs of a skin infection. While very rare, a serious allergic reaction to this lotion can occur. Seek medical help immediately if you experience symptoms such as rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed here, it is important to consult your doctor or pharmacist. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Unicare Moisturizing Lotion, make sure to inform your doctor or pharmacist about any allergies you may have. It's important to consult your healthcare professional if you have any skin cuts, infections, or sores before using this product. Some ingredients in the lotion, such as preservatives or fragrance, may increase sensitivity to the sun, so be sure to check the label for any warnings and take necessary precautions when outdoors. If you have acne-prone skin, look for the word non-comedogenic on the label to ensure that the product will not clog your pores. Additionally, some products may have the potential to stain or discolor clothing, so it's best to ask your doctor or pharmacist for more information before use. Before undergoing any surgical procedures, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, consult your doctor before using this product as it is unclear whether it passes into breast milk. Using Unicare Moisturizing Lotion may interact with other drugs, which could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. If this lotion is swallowed, it can be harmful. If someone has taken too much and is experiencing serious symptoms such as passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. U.S. residents can call their local poison control center at 1-800-222-1222, while Canada residents can call a provincial poison control center. When trying to prevent dry skin, using lukewarm water instead of hot, bathing less often, keeping baths/showers short, and using a humidifier in dry air can be helpful. There are various emollient products available, including those with fragrance or other ingredients that some people may be sensitive to. These products come in different forms such as oils, creams, lotions, or sprays. Make sure to consult with your doctor or pharmacist to find the best product for your needs. If you forget to use Unicare Moisturizing Lotion at the regular time, use it as soon as you remember. Do not apply extra lotion or use it more frequently than directed to make up for the missed dose. Make sure to check the storage information on the package before using Unicare Moisturizing Lotion. If you have any questions about storage, ask your pharmacist. Keep this lotion away from children and pets. Avoid storing the lotion near high heat or open flames, as it is under pressure. Do not puncture or burn the container. Do not dispose of the lotion by flushing it down the toilet or pouring it into a drain unless instructed to do so. Properly discard the lotion when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.